And we are live. Hi, good evening, everyone. Welcome to Level Up Live. I am Dr. Sharita Gaskins-Tillett. I am your host, and I'm so happy that you are joining us this evening. I have a tremendous treat. I'm so excited to share this guest with you guys. If you are watching us live, say hi in the chat. If you are watching the replay, hashtag replay, please put your questions in the chat. If you're watching the replay, still put your questions in because I will get those questions to our guests and do our best to get those answered for you. So I just want to give a few more seconds for folks to come in and then we'll get started. All right. So I'm happy to announce our guest this evening, Dr. Victoria Sorlie-Aguilar. She is a family physician near Los Angeles who graduated from USC Keck School of Medicine in 2003. She has practiced medicine for over 16 years and is deeply passionate about menopause and women's sensual health. Her mission is for all women to feel confident, joyful, and sensual throughout menopause and beyond. She will also talk about desire, arousal, and how we can cultivate more pleasure because our sensual health is important. So welcome, Dr. Victoria. I love to call her La Flama. La Flama. Once you guys see her personality, she's just, a firecracker. So welcome, Dr. Victoria. How are you?
Thank you so much. I feel like wherever I go, there's a soundtrack playing This Girl's on Fire. I hear it anyway.
I believe there is, actually.
Just getting out of the shower.
Yeah, I feel like that whenever I'm around you.
Yay! Awesome. Every woman should feel that way, for sure.
Absolutely. So tell us a little bit about you. Tell us about your journey through medicine, and more important, how you became La Flama.
Ooh, that's a good one. So I actually went to UC Davis undergrad, and I majored in psychology. I think you said you majored in psychology.
I did. And actually, I was in Southern California. I was at Pomona College.
Ooh, okay, that's really close. So I majored in psychology. I was really excited, so curious about the human mind, the mind-body connection. That was like around 1994. So around that time, they were just starting to put all of that together about how much our thoughts and our mindset impact our physical health. I know you know so much about this because you work with women on their mindset and their meditation and their breathing and their outlook and knowing themselves. I was so curious to find out about that when I was younger. And I thought I might go into psychology, and I did a couple internships. You're undergrad. I was probably like 23 years old or something. And I didn't really have a good connection with someone. I didn't see anyone doing anything that looked like what I wanted to do. So a couple of my friends were pre-med. So I was like, this is healing. This is body and mind. I can look into this. I did I changed my major to biopsychology. So I could get biological psychology. So I could do both. I did my pre-med. I applied to med school, and fast forward the wild ride that's pre-med. In 1999, I hit USC med school. And, what an experience med school is, right? What a wild ride. Absolutely.
And it sounds like you and I were kind of on parallel tracks.
Yeah.
I'm listening to your timeline and the dates and, parallel tracks. But anyway, continue.
So I wound up at USC med school in LA and did my 4 years there, and could not decide what to do for a specialty. I really loved gynecology, and I really loved pediatrics, and I couldn't choose. I was like, what? How can I do them both? Oh, family medicine.
Right. Yep.
So I really always loved, I love talking to women. I love talking about women's health. I love learning about the woman's body and also children. I really love the energy and the sort of spunk and the quick recovery of children. For the most part, there's some situations that aren't like that, but I really loved it. So I chose family medicine so I could do sort of the full spectrum. Everything. And enjoy wellness and talking about wellness and preventative medicine. And boy, every day I feel like I'm a little bit of a psychologist, a little bit of a little bit of all of it in family medicine.
Right. Well, and that's actually all of medicine. I think there's studies that show that more than 70% of office visits have some psychological component. So you are absolutely right.
Yeah, because you can't separate it, right? We don't walk in and say, "Oh, I only want to talk about my body," or "I only want to talk about my mind." As a person, we just perceive it as how we feel, and it's
Right.
filtered up through our brain, out our mouths, our heart, our tender hearts get involved with it, and it is really a sacred calling that we do, and it takes a lot of heart and soul out of you. And but sometimes you get just as much as you give, maybe even more than you give in this work.
Yeah.
So
So
yeah,
now
I've been doing it for a long time.
your current practice, are you full spectrum family medicine or do you concentrate on women?
Well, I don't do deliveries, but I do full spectrum family medicine. Other than that, and my journey sort of took a turn when I myself went through my menopause journey. I really, around the time I was 42 or 43, like some of us do, I started having really wildly irregular periods. And I thought, oh, I'm just stressed out. I'm kind of working hard. I'm a couple pounds overweight. Maybe my period's just off kilter because I'm stressed and a couple
Yeah.
pounds overweight. Maybe I haven't slept enough. And I just didn't really think about it, because if you don't have your period, you're like, I don't
Right.
miss it much. It's like I'm gonna go seek it out.
Unless you're young and you're worried about other younger and worried about other
Yeah,
things. Yeah,
yeah. But once you're
right.
in your 40s, you're like, meh. So I really didn't think too much of it. I just sort of chalked it up to stress. But the between 43 and 44, not only did I stop having periods altogether, but I started feeling horrible. I really started feeling hot flashes and night sweats, just classic. And
Yeah.
I couldn't sleep. I could not sleep. Monday through Friday, couldn't sleep. No matter what, couldn't sleep. And like your doctor, you got to get up and go to work anyway. You can't
Right.
be like, oh, I
Sure.
didn't sleep well, I can't go to work.
I'm gonna
So I
call
just
out,
kept
right?
pushing. Yeah, I just kept pushing through, and I thought I was just
Sure.
stressed. I mean, I was stressed, but I thought it was just me. So I was like, looked into mindfulness, took some melatonin, found some sleepy time tea, but it just wasn't cutting it. And then I started to feel kind of anxious and little depressed too. So I didn't know then. Of course, I know now. And hindsight is 2020. I was like, okay, hot flash, night sweats, insomnia, anxiety, depression, menopause.
Right. Right.
Perimenopause, menopause. I just didn't know.
And you know what's interesting is that you are a family physician. You take care of women, so you would think that physicians would know, you know, the signs of menopause, would be able to recognize it in themselves and identify it in others more readily.
Yeah. Yeah. Well, when I went to med school, 99 to 2003, it wasn't a huge part of our training. It was a small part, maybe in the gyne rotation. And the time that I trained, it was like menopause is going to happen. It's like a year of a woman's life. You really don't want to give her hormones because, that's super dangerous.
Or yeah,
Avoid it at all
it was
costs.
really taboo back then. You're absolutely right.
Yeah, it was right after the WHI in
WHO, yeah.
2003. So, and then the pendulum has swung slowly but surely back. But unless someone has a vested interest in it, because of personal, there's really no like, hey, ladies, we got to, hey, family doctors out there, we need to know menopause. It just doesn't happen unless a doctor has a personal vested interest or their personal, curiosity for it. It just doesn't come around again, and you're stuck
Right.
with the old training. Yeah.
Yeah, absolutely. So what happened next? So you were feeling, poorly. You recognized that something was going on with you. How did you come to realize it was menopause, and then what did you do about it?
Well, so I just started doing my own research. I read every book I could get my hand on, started reading articles, looking up the guidelines, asked my girlfriends who were doctors, hey, ladies, you guys are 55. What are you doing? I got together, my girlfriends over a dinner, and we all sat down and we said, let's talk about, which isn't really the right way to do medicine, but I was like, let's talk about what you guys are doing because I want to know. And I realized everyone was kind of winging it.
Yeah.
And there was not a consensus among us. And no one was actually sure what was the best thing to do. And I thought, hey, if I don't know and they don't know exactly what to do, how can everyone else
Right.
know? And
But
that's
that's
when I
here's
decided
the
we need to
thing,
be
though. I think
proactive.
a lot of it is things to do with women and women's bodies has always been really taboo.
Yeah.
They've always been really taboo. I'm a whole OBGYN. And when I had my daughter, there were things that happened to me in that postpartum period that I was not prepared for. I had no idea that these are the things that were happening to my patients because they weren't telling me. Nobody else was telling. None of the textbooks told me. None of my colleagues told me.
Yeah.
So it's like, there are things that we know, and then there are things or I guess I should say things that we talk about,
Yeah.
and then there are things that we kind of hold close and don't say very much about. And I think that menopause is one of those things. Everybody equates it with the hot flashes and the night sweats, and of course the no period. But there's so much more
Yeah.
that goes into that.
Yeah. So much. And, can you imagine every woman on earth? Not every woman on earth will have a baby, but every woman on earth will go into menopause, because that's just,
Right.
when
That's
when
the
we're when
cycle of
we're
life. Right.
yeah, when we're a preteen, even in elementary school, they pull us aside and be like, you're going to have a menstrual cycle. This is how you take care of yourself. These are the ways you might feel. And then we sort of go, 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 go. And no one tells us, hey, at the other end of that,
Right.
there's an exit ramp and it's really bumpy and it's kind of crazy. And
Right.
you're going to question all these things that you're feeling and you're not going to know. And no one actually tells us how to prepare ourselves for that at all. So it doesn't have to be so scary. It doesn't have to be so anxiety ridden. We women, we put up with a lot.
Yeah.
We have families, we go to school, we take care of our loved ones, our parents and our children. We can do so much, but we just need a little guidance. We just need a little roadmap. If we've got a roadmap, we can figure it out, but we don't get the roadmap.
Right. Right. No, you're absolutely right. So tell me about the roadmap that you discovered.
Yeah. So what I learned in all the research is like you said, everyone knows about no period. Everyone's heard about hot flash, night sweats. Maybe they've heard about insomnia too. But those are just the most common. It's the things that we don't know about that are happening that we're not really weighing in our considerations about what we're going to do about it. Even something as simple as palpitations. A lot of people, a lot of women in midlife complain of palpitations. I see it in my office. That is a symptom of menopause. And we go to our doctors and we get a, $1 million workup,
Right.
which we
Yeah.
should, and then the doctor's cardiologist says, you're okay. And then the woman's like, I'm okay. I'm still having palpitations
Right. Right.
with,
Right. Right.
menopause. So, up to over 50% of women over 50 will suffer from anxiety symptoms. Over 50%. That's
That's huge.
most of us.
Right. Right.
And a third of us will have depression symptoms. And so that's a whole bunch more of us. And the evidence shows that women who have severe hot flashes are more likely to have depression and anxiety symptoms. We don't know the connection of why, but we know they go together. So mind, body,
Right.
we feel the hot flash, we get the anxiety, we get the depression, and it's all tied together in a way that we can't really extricate it out. And
Right.
when a woman's feeling anxious and when she's feeling depressed, that might be when she's least likely to go get help. you
Yeah.
know so I
Yeah.
think the first part of the roadmap is education, and we have to go find reliable education, because we can Google and search the internet, which I'm guilty of it too.
Yeah.
I'll do it
Yeah.
too, but there's all kinds of craziness out there.
There are. There
How
is.
do you discern between someone who's trying to sell you some bogus supplement and actual reliable information? It's kind of a jungle out there.
Absolutely. So, what have you discovered that's been helpful for you, and that you recommend for your patients?
So I think that the first step is to educate ourselves about it. So that's sort of why I came into menopause. I thought, if I don't know and I'm a doctor, what hope do the rest of us have?
Sure. Absolutely.
So looking at the North American Menopause Society, looking at talking to our doctor, just bringing up the conversation, because a lot of times we might go in, with menopause symptoms, we might be offered a blood pressure medicine or a depression medicine, which is okay. They've been known to help in some ways, but they don't really treat the root of the problem, which is the fact that once we hit a certain age, our ovaries are no longer producing estradiol in significant amounts, which is the chemical name for estrogen. and they don't really take care of all the other changes that are happening that aren't just hot flashes and depression.
Right.
So one, getting informed, two, talking to our doctors and really not letting ourselves be blown off. I mean, our doctors are so busy, you go
Right.
in, you've got a 15 to 20-minute visit. Maybe if you're lucky, you get your labs checked, maybe get your mammogram. And there doesn't leave a lot of time in that annual physical to talk about all of the other things that are in our lives. So we really need to prioritize ourselves and schedule an appointment just for this conversation.
Right.
It deserves, the time it takes, maybe more than once. Maybe we've got to go back again. Maybe we have more questions after the first conversation, but we're worth the time it takes. If we have high blood pressure, we'll go
Right.
back again. We'll talk about diet. We'll talk about meds. So menopause deserves, as much, if not more attention as all of the other things that we talk to our
Right.
doctors about.
Because the reality is we'll spend half of our lives in menopause, all things being equal. Well, not maybe not quite half, maybe a third, but a significant portion of our lives will be spent in menopause. And
Yeah,
it's important that you weather the journey as well as you can. So now you
absolutely.
mentioned, tell us about some of the different symptoms. We talked about the hot flashes and the night sweats and anxiety and depression, palpitations. What are some of the other manifestations, physical manifestations of menopause?
Just a bunch of really crappy sounding symptoms, but like dry mouth, dry eyes, dry skin, hair loss, osteoporosis, bone thinning. That's just to name a few. And then that's all the stuff that's like above the belt. Then there's everything below the belt. And
Yeah,
that's, like you said, some of the stuff that we don't always want to talk about with our friends or our doctors, but we must. And that's so dry skin, dry mouth, dry eyes, dry vagina,
yeah,
lack of lubrication, and urinary frequency, and sometimes sneezing and peeing, which nobody wants to talk about. And 80% of women will have those symptoms. So while no one's talking about it, everyone's
everybody's
feeling
dealing
it,
with it. Yeah,
suffering in silence. And that symptom right there, those genitourinary symptoms, they're sort of like the easiest thing to fix if we just ask for help from our gynecologist or from our family doctor. And most women don't ask for help, and maybe the doctors aren't asking the women proactively about it,
yeah,
enough as much as we should. Because if 80% of the women are feeling it, then we can guarantee that 8 out of 10 of the women in front of us, if they're over 50, are probably having that
right,
symptom.
right.
And, we have safe treatment for that. I know, but I don't know if most women know that we have safe treatments for vaginal dryness and safe treatments for urinary incontinence and frequent urinary tract infections. And that simple safe treatment could change the quality of a whole woman's life. Like you said, we might live 20, 30 years on average in menopause.
Yes,
So we don't just want to sort of shrivel down and into a corner and just suffer. And we can thrive, we can stay healthy, we can stay sensual, radiant, confident, all of it. I mean, my plan is to stay that way the whole way.
yeah,
But I don't want to be the only one. I want all of us to do that. We
right.
all deserve that. We work so hard in our lives and our youth, hustling and working and studying and our jobs and our families. We deserve, when we get to the pinnacle, we hit the pinnacle of our lives, we should be able to take
Yeah.
the ride in joy and confidence and maintain our sensuality.
So tell us how we do that, because you are doing a fabulous job of doing that.
Thank you so much. Thank you so much. You too. I mean, you are crushing it out there. I love watching you talk about your journey. I love what you're doing for women, talking about the mind body connection and mindfulness and really knowing what you want out of life.
Yes.
I'm so glad to see a woman sitting in her power doing that. And I think that more women would, if they actually were able to hold on to their spark, their
Yeah.
flame. And that's why I called my business Feminine Flame, because I really believe we have a fire inside of us. And it's natural. It kind of comes natural when we're confident and maybe when we're younger and we're just feeling like we're in our zone.
Yeah.
And for some women, and including for myself at that time when I didn't know what was happening, I sort of felt my flame dying out. And I thought, well, maybe this is just how it goes. You
Yeah.
your
Well,
light goes out.
but I think you hit on a really important point. that there's this kind of acceptance that that a lot of people assume that it has to be this way,
Yeah.
and don't recognize that they actually have the power to change things.
Yes.
So again, the
Yes.
whole thing of owning your power, but knowing that you have to first know that you have the power, right?
Yes, yes. And as far as the dryness, the incontinence, I mean, those totally impact your confidence. If you're incontinent, which a lot of women suffer from that, there goes your confidence, and you think, okay, well, I guess I'll just wear diapers, from now on. And, some women have, a spinal cord injury or something, and it's inevitable. But for most of us, if it's just because of menopause, so just for example, urinary incontinence, I know but the doctors can refer you to pelvic floor physical therapy, and you can
Right.
strengthen your pelvic floor muscles, and you can learn to, have better control. That's just one simple thing. One
Right.
simple thing. And I think a lot of women don't know to ask, and no one offers. So they just sort of like,
Yeah.
another thing is low dose vaginal estradiol. It's generic, it's cheap, it's mostly covered by insurance, but also offered at a discount on websites like GoodRx. And so if we use low dose vaginal estradiol, if it's right for us, if our doctor prescribes it, we can ask our doctor about it. We can
Yeah.
start the conversation. We can say, I'm noticing some dryness. I'm noticing a little urinary incontinence. I'm on my third urinary tract, my bladder infection this year. Like, why do I keep getting bladder infections? It's not a coincidence. It's what happens when we're over 45, and when we're not having estradiol. These changes happen to our vulva and to our vagina and to our urethra. Our vulva is the outer part of our vagina. I know your audience
I
probably
love
knows
the
if they
pop.
listen to you.
Go for it. Yep.
Yes. Our outer labia, our inner labia, our clitoral hood, our pleasure center, our urethra, where we pee from. When there's no estrogen, we lack circulation and we lack sensation, and the pH even changes, and we become more susceptible to infection and injury, and our tissues even thin out and become less plump, less healthy because of a lack of estradiol.
Right. Right.
And if we talk to our doctor about the symptoms, we have to be brave. We have to talk about it and then ask, what can we do about it? Because we can get prescribed low dose topical vaginal estradiol in a cream that we could, it's so simple. We could
Right.
prescribe it. We could use it to the inner labia, to the urethra clitoral area. That one little thing could change so much for so many women. And we just have to ask. And if our doctor is not aware, like if we happen to have a doctor who's not schooled on this, not up to date on this, then we ask again until we get an answer. Most family doctors should be able to prescribe that. Every gynecologist should be able to prescribe it. And there's very few women who cannot use it. Very few women. Most women, 99% of
Right.
women, will be able to use it.
So now there are a lot of people, we talked about, we touched on a little bit earlier about the apprehension some people have with taking hormones, because hormones get a pretty bad rap. It's a normal part of our bodies, but taking extra hormones is really scary to some people.
Yeah.
So how do you counsel your patients who are dealing with significant menopause symptoms but are reluctant to use hormones, but don't have a contraindication? Like there's no medical reason that they can't take hormones. They're just afraid of them. What do you say to those ladies?
Yeah. And this is exactly why I'm here right now talking to you, because it does feel like a bit of an uphill battle to counterbalance that fear. Women, we want to be careful. We want to avoid danger. We're evolved to weigh risks all the time. We want to
Yeah.
protect our family. We want to protect our children. We want to protect ourselves. So it's natural to be cautious. It's natural to be a little bit, take precautions. And this one is maybe where we're taking a little bit too much precaution, and we're making decisions from a place of fear. And we never make good decisions from fear. We make good decisions from a place of wisdom. If we just did a little education on it. So low dose vaginal estradiol is a hormone. It's true. It's identical to the hormone our body produced before menopause, and it is safe, very, very safe, because the medication, the effects only act where we put them. If we put the cream down here, this is where it takes effect, just where we need it. It's not systemic. It doesn't go to your brain. It doesn't go to your heart. It doesn't go to your bones. That low dose vaginal estradiol for those vaginal symptoms, it just goes down there. And that's what I tried to explain. It's not systemic. It is just local. It's very safe for most women. And that's just, that's just the lowest hanging fruit. That's just like the easiest thing. There's also systemic hormone therapy, which many women would benefit from. There's some women who can't use it. And there's very nice guidelines from the North American Menopause Society that have come out that were just posted last year, 2022. The position statement that said, for women around 50 or within 10 years of menopause with symptoms, hot flashes, night sweats, vaginal dryness, if they don't have a contraindication, the benefits outweigh the risks. That's
Yeah,
a huge statement for them
it
to say.
is.
And that's on systemic hormone therapy. Because that talk about the pendulum swinging, it took a long time
Right.
for them to come back to that. And it will take some time for women, doctors even, but
Feel
women
comfortable.
who aren't doctors to get up to date and go, hey, I heard, do I have a contraindication and I'm suffering? I might be interested in trying that.
So now, what do you say to people who say, "Well, I don't want to be on this stuff for the rest of my life. I'm in menopause. Do I have to take this forever?"
It's a great question. So back in the days, we were taught that if we did give a woman hormone therapy, it was the lowest amount for the least amount of time and then take her right back off of it. That's how we were trained. And right now, like I said, the pendulum swung. So now, if a woman doesn't have contraindications, the guidance is to check in with her on an annual basis at least, see if she's still having benefits, see if she's still needing it. And if she doesn't have a compelling reason, if a contraindication hasn't come about, she could continue to take it. There's not a definitive time that says you can no longer take it. This is where
Right.
it really depends on our doctors being educated about it, because it has to come on a one-to-one decision, because every woman's different. Some of us have
Right.
diabetes, some of us have high cholesterol, some of us have high blood pressure, and all of these things need to be weighed. We need to be able to talk to our doctor about it.
Right. Well, we have somebody in the chat. They said they had a patient ask if hysterectomy would fix those symptoms.
That's a great question. So the question is, what symptoms? You know, so
Yeah.
if it's hot flashes and night sweats, nope. Because the problem is lack of estradiol,
Right.
and whether
Right.
or not we have our uterus, we're still in a low estrogen state. If the problem is vaginal dryness, nope, we're still going to have that symptom. So no, not really.
Yeah, it's not going to fix right, but
Hysterectomy,
it's just, I think that really just speaks to the lack of knowledge that's
yeah,
out there for the general population. So
yeah.
now you found your roadmap. Tell us how different you feel now versus how you felt before.
Well, knowledge is power, right? So once I knew that it wasn't just me being a little anxious and a little, overstressed, once I knew these were common symptoms of menopause, then I could say, okay, this is menopause. I can get help for this. It's not just, a character flaw on my part. It's not just me not being able to cope with my day to day. So knowledge is power. Taking the time, investing in yourself, and giving yourself the time it takes to get the wisdom you need. That's number one. Then finding your doctor that you can talk to about it, that won't kind of brush you off. Don't let yourself be brushed off and say, oh, just, suck it up and,
Yeah. Yeah.
drive on. No, you deserve to get your symptoms addressed, and you deserve some relief, and there is relief, and there is safe treatment. So, getting help, getting wisdom, and seeking help, and not letting yourself be brushed aside. And I think that comes with wisdom. Like I said, if you're making decisions from a place of wisdom and confidence and not from fear, fear doesn't get us
Right.
anywhere.
Right.
Not letting ourselves be sort of scared away from getting treatment.
So after you found treatment, though, I'm trying to get to a personal thing here. After you found treatment, because again, I've spent time in your company, and you are one of the most vibrant people I have ever met. And
Oh, thank
so
you.
my question is, how different are you now? When did you turn that corner? What caused the changes? I know you say you were feeling all of these things,
Yeah.
but tell us about the transformation.
Yeah. So, I mean, just imagine if you can't sleep and you're stressed and anxious and having stress incontinence and low sensuality because of dryness. I mean, it's just a bad scene.
Right. Yeah.
And all of a sudden, just the one thing, sleeping at night.
Yeah.
When I started systemic hormone therapy, I started sleeping at night, like going to bed like a normal person and waking up in the morning like a normal person.
Yeah.
Hallelujah,
Well,
sleep.
sleep, yeah, and we know sleep impacts every
So
organ system, right?
important. If you're sleeping, then you're well rested, then your mood is better. You're not grouchy with everyone. You've got more energy for work, for your family, for intimacy with your partner, just that one little thing changes everything. And that's just one part, the sensuality part. I mean, having your genital system work normally,
Yeah.
having your mood and your confidence back, not breaking out in a sweat every 10 times a day. So much of that, you feel like you have more control over your body again. You feel like you know yourself again, you know how things are going again. It was just a huge change for me. There's some women who can't take hormone therapy for like because they fall into the category of women who have contraindications to systemic hormone therapy. And and it's not hopeless still. There's other things they can
Yeah,
do for the hot
exactly.
flashes and the sleep. So there is treatment and hope and a better day for every woman. And we just need to see where we fall on that. But we deserve the time it takes. Women, sometimes we put ourselves at the end of the line.
Absolutely.
We'll get the dentist for the kids, we'll get the husband's appointment, we'll take the dog to the vet before we'll take care of ourselves.
But
But
here's
we
the
have to take care of
here's
ourselves
the
so that
thing
we
though.
can help everyone else.
Exactly. That's where I was going with it. If you take care of yourself, if you're getting the sleep that you need and you're feeling well, then you're better equipped to take care of everyone else, which is,
Yeah.
often our goal anyway.
I mean, it should be enough to say we're doing it for ourselves. But if you
Right.
can't get there right now because you're that mama and wife and daughter that puts everyone
Right.
ahead, okay, then say you can serve others better when you take care of yourself. Self-care is an act of service to others because
Yeah,
you're in a good place. You can do more for others.
absolutely. So I want to hear about Feminine Flame MD. What is it? How did you develop it? And what do you do there?
So when I sort of figured everything out, I spent actually several years figuring all of this out, because I have a full-time job. I didn't just, like
Right.
run
Yeah.
up a mountain and do all of it. But I have my full-time practice, but I devoted all my time I could, every waking moment that I wasn't seeing patients, to figuring this out. What are the guidelines? What does the research show? What is the history of menopause? What are my treatment options? What are the ups and downs of everything? And once I figured that out, I sort of became like talking to all my friends. Hey, did you know? What are you doing? What are you doing? Hey, you could do. And I sort of found myself repeating the same things over and over again. And I really got so excited because when you feel good and you feel confident about your decision, you want all your friends and your family and your sisters and your cousins and the neighbor. I just wanted to shout it from the mountaintops because women deserve to thrive, not just survive. So I
Yes.
thought, okay, how can I reach more than just sort of like grabbing the ear of everyone that walks by? I thought, okay, I can make, a platform, a digital course. I'm on Instagram, Feminine Flame MD, and on my website, feminineflamemd.com. And I just started making educational videos, downloadable videos, and podcasts and all of that, talking about just everything we've talked about here. And I said, well, some women are going to want to have like a beginning and an end point. Like I enter here and I don't know a lot and I come out on this side and I'm prepared to talk to my doctor. So I created a digital menopause mastery course with Feminine Flame MD where you learn how menopause changes you, how you can ask for help, what are the risks and benefits specifically of all the treatment, how it's given, how you can talk to your doctor in a way that they can sort of, we doctors, we're sort of used to hearing things in a way. We,
Yeah.
we like things to sort of be laid before us, really obvious. We can't sort of beat around the bush. We got to be really obvious about what we're talking about. And sometimes, like I said, that means dedicating an appointment to it. So I figured the way I could reach the most women was through giving them the wisdom that I took the time to get, distilling all that down in a really straightforward way so you could come in not knowing what was going on, come out the other side ready to talk to your doctor about what your treatment options are. Of course, every woman still got to talk to their own doctor because we all have our own medical history that's really
Sure.
particular to us. But just knowing that you have the wisdom, so when your doctor tells you something, you have enough wisdom to say, okay, now what about this?
Right.
So no for this, what about this? What are the benefits of that treatment? What are the risks of that treatment? because if we don't know, it's just too much.
So when do you recommend women learn about this? Do you recommend they wait until they're actually in the middle of it? Or do you catch them like,
Imagine
late 30s, early 40s?
Imagine if instead of me stumbling through my mid 40s, suffering in silence, embarrassed, irritable, anxious, depressed, and anxious, if I had known, what was coming, what I could do about it, I could have just taken it in stride. I would have been
Yeah,
like, oh, it's happening. It's time to take action. Imagine it could be that easy. It could be
sure.
that seamless. It could be that natural, just like our first period. Okay, we're ready. Now the end. So, I mean,
Yeah,
I think if a woman's in her early 40s, because the average age of menopause is 50, but it can span 45 to 55. So we can get there early, we can get there late, we can get there
right.
like me before time. But she doesn't read the book and follow the
No.
rules. She does whatever she wants.
Well, I mean, and actually the rule is 40. Anybody over 40 is considered, like it's fair game.
Perimenopause, because you can start to have those symptoms even 5 years before the last period. So
Yeah.
you can be 41, having irregular periods, having hot flashes, and starting to feel like you're menopausal, even though you still have a cycle. So absolutely. If you're 40 and above, there's women that go into menopause below 40. That's called premature menopause.
Yeah.
I know you know. And that has serious implications. We can't just be like, oh, I'm 38, I stopped having periods. I mean, that's has a huge impact on a woman's life. And so, I mean, at the bare minimum, if you're 40 and you want to know what's headed down the line for you, we should want to know how we prepare ourselves and how we can help our sisters and cousins and moms and all of that stuff. If you care about women's health, if you care about your health going beyond midlife, that's the right time. And go to Feminine Flame MD, sign up for my master course, and get that wisdom.
Because honestly, it helps to put you back in the driver's seat of your life. I think one of the things that makes us feel so nervous and anxious is that sense of no control, that things are happening to us and we don't have a say. And yes, this is something that's happening to you that you don't get a say, but you do have some power that you can exert to make things different. I'm all about women owning their power and living their best life, and certainly educating yourself about your body, about what's normal, what's not normal, and what the options are will go a long way toward helping you to live your best life, through menopause, through the menopausal change, and beyond.
Yeah, absolutely. And look, if a woman does all the research and she decides, hey, I still don't want hormones. I did all the research. I don't want to do that for whatever reason. Good. That means you made a decision based on wisdom,
Right.
not based on fear. Whatever decision you make based off wisdom and confidence is a good decision for you. But from wisdom, not from fear. That's what I want for every woman.
Yeah. We have a comment in the chat. Having Mirena kind of blinded me to the idea of being perimenopausal because I wasn't noticing the change in my periods.
That's brilliant.
Yeah.
Well, this is why I say, some women don't get their periods. Some women have a Mirena. Some women have had a hysterectomy, so they can't always take that signal from their. Some women are on birth control pills continuous, and so they can't always take the signal from the
Right.
period. But that hot flash that 70 to 80% of women are going to get, that is pretty indicative.
Yeah.
And also, it's a news flash. Hot flash, news flash. Perimenopause or menopause is happening. It's time to talk to my doctor. Because
Right.
we have ways we can still figure that out.
Yeah. Yeah.
Yeah.
Absolutely. Well, we're just about out of time. So I have a question I'd like to ask everybody. I think I probably know the answer to this because of what you've already said to us. But if there's one single best thing that a woman can do to own her menopause transition, to make the most of it, what would you recommend?
Ooh. Valuing yourself, giving yourself priority. We're so busy. We work so hard. We hustle, we work, we sleep, we tech, we kid, we wife, we everything. We have to pause for a moment. Like, I love it when you say that, just pausing and taking a breath and looking around, taking stock and giving ourselves enough priority and importance to take the time to figure it out. We can make any decision once we have the facts. And we don't have the basic facts. For whatever reason, it's not prioritized in our education, either in, high school, middle school, or med school even.
Yeah.
And so we have to take the power back, get the facts, and make decisions from wisdom. We take driver's tests, we pass the bar, we pass the teacher certification. We can do menopause. We just need to prioritize our health the same way we prioritize everything else in our lives. Keep that feminine flame burning, prioritize our femininity, our sensuality, our radiance, our confidence. We are worth it. We're worth the time it takes. We deserve to be healthy and thrive, not just survive and get by.
Absolutely. I agree wholeheartedly. It has been a tremendous pleasure. I've been looking forward to talking with you. You
Yay.
did not disappoint. Ladies, check her out, Feminine Flame MD. She can help you, educate you through the menopause transition, and also educate you before you begin.
Absolutely. Thank
So
you.
thank
Thank you
you
for
so much,
Dr.
Dr.
Sharita.
Victoria.
Thank you for the space. Thank you for Level Up Lady Doc and highlighting what so many women are doing and how we can do self-care and highlighting the amazing things women do. We are amazing.
We are.
Amazing. And we can
We are
stay that way.
limitless. I love
Yes,
to say that we are limitless. We're only as limited by our imaginations. We can do anything that we decide we want to do, including
absolutely.
owning our menopause journey, right?
Absolutely. Thank you for having me. It's been a pleasure.
All right. Thanks for joining us, guys. We'll see you next week. Take care.